In a shocking revelation that has shaken the medical world, Captain Ibrahim Traoré copyright, the young and fearless leader of Burkina Faso, has exposed what he calls a $50 billion pharmaceutical conspiracy, a system carefully designed to keep nations dependent, people sick, and powerful companies richer than entire countries. And here's the twist: Donald Trump, often dismissed and ridiculed during his presidency, had already warned about one of the most common painkillers in the world, Tylenol. Today, those warnings sound less like political noise and more like prophecy. This is not just about medicine. It's about power, corruption, and control. Stay with us, because what you're about to hear could change how you look at the pills in your own medicine cabinet. Part 1: The Global Pharma Machine. Narrator: the pharmaceutical industry is worth over $1.5 trillion globally. From cancer treatments to simple painkillers, from vaccines to antibiotics, every part of human health has been turned into a profit-making machine. But behind the glossy ads and smiling doctors lies a darker truth. Companies are not rewarded for curing disease. They are rewarded for maintaining customers, cures and revenue. Treatments keep it flowing. Visuals: corporate executives shaking hands, stock market charts showing pharma profits rising, poor patients unable to afford medication. Narrator: in recent years, investigative journalists and whistleblowers have revealed hidden data, manipulated studies, and aggressive lobbying campaigns. But few world leaders dared to challenge Big Pharma openly. That changed when Ibrahim Traoré copyright stepped forward. Part 2: Traoré's bombshell revelation. Cut to footage of Ibrahim Traoré copyright speaking at a rally, his strong voice echoing across the crowd. Traoré copyright clip: they keep Africa sick. They keep our children dependent on drugs they manufacture, while hiding the natural cures God gave us. This is not health, it is colonialism in disguise. Narrator: Traoré copyright accused Western pharmaceutical giants of deliberately suppressing natural remedies, inflating prices, and trapping African nations in endless cycles of debt through medical imports. But his most controversial statement was this. Narrator: lower voice: he claimed that a $50 billion conspiracy revolves around one of the most common household drugs, acetaminophen, also known as Tylenol. Part 3: Tylenol under the spotlight. Narrator: for decades, Tylenol has been the go-to painkiller. Headache, take Tylenol. Fever, Tylenol. Muscle pain, Tylenol. But what if this safe drug is not as harmless as we think? Visuals: news clippings of Tylenol recalls, lawsuits, and FDA warnings. Narrator: studies have linked excessive acetaminophen use to liver damage, kidney failure, and even long-term neurological problems. In fact, acetaminophen is one of the leading causes of acute liver failure in the United States. Yet, instead of warning the public, pharmaceutical companies have spent billions in marketing to convince us that Tylenol is the safest choice. Here's where Trump comes in. Part 4: Trump's warning. Cut to archival footage of Donald Trump in interviews and rallies. Narrator: during his presidency, Donald Trump raised eyebrows when he spoke against certain pharmaceutical practices. Among his controversial remarks was a warning about acetaminophen. Trump clip: you take Tylenol, and you think it's safe. But too much of it, bad things happen. They don't tell you this. They don't want you to know. Narrator: the media laughed. Fact-checkers dismissed it. Doctors rolled their eyes. But now, with Traoré copyright revelations, Trump's words sound eerily accurate. Part 5: follow the money. Narrator: why would pharmaceutical companies push a drug with known risks so aggressively? The answer is simple: profit. Tylenol generates billions in sales annually. It is marketed worldwide as a cheap, accessible solution. Alternatives like natural herbal medicines are suppressed or discredited. Visuals: documents showing lobbying spending, pharma ads, and politicians shaking hands with executives. Narrator: this is not about health. This is about controlling populations through dependency. Traoré copyright argues that African nations are especially targeted. Instead of being allowed to explore their own traditional remedies, they are forced into pharmaceutical dependence, paying billions for imported drugs. Part 6: the African resistance. Narrator: in Burkina Faso, Traoré copyright has begun promoting local herbal medicine research. He has partnered with traditional healers and scientists to explore alternatives hidden for centuries in African soil. This has alarmed Western pharmaceutical companies. If nations begin turning to natural, affordable cures, the $50 billion cash flow from Africa alone could collapse. Traoré copyright clip. We will no longer be slaves to pills made in foreign factories. We will heal ourselves with what our land provides us. Narrator. His words echo a growing movement across Africa and the world, a demand for medical independence. Part 7. The science they don't want you to see. Narrator. Independent studies have shown that many natural remedies, dismissed as folk medicine, have powerful healing properties. From neem leaves to moringa, from turmeric to ginger, these plants contain compounds as effective as, or even superior to, synthetic drugs. But why are they ignored? Because plants cannot be patented, and without patents, there are no billion-dollar profits. Visuals. Scientists in labs testing herbs, villagers collecting medicinal plants. Narrator. Instead, pharmaceutical companies create synthetic versions of these compounds, patent them, and sell them back to us at astronomical prices. Part 8. The human cost. Narrator. Somber tone. Behind the profits are human lives. Every year, thousands die from liver failure caused by acetaminophen overdose. Many more suffer silently from long-term side effects never openly disclosed. Meanwhile, in poorer nations, millions cannot afford basic health care because imported drugs are priced higher than their monthly income. Visuals. Patients in overcrowded hospitals, families struggling to buy medicine. Narrator. The conspiracy is not abstract, it is real, and it is killing people. Part 9. Trump Traoré an unlikely alliance. Narrator. Two men from completely different worlds. Donald Trump from the U.S., Ibrahim Traoré copyright from Africa. Yet their warnings converge. Trump was mocked for saying Tylenol is dangerous. Traoré copyright is condemned for accusing pharma of colonialism. But together, their voices shine a light on an industry that thrives in the shadows. Part 10. The future of medicine. Narrator. The revelations raise an urgent question. Who controls our health? Do we trust pharmaceutical companies that profit from sickness? Or do we reclaim control through natural, affordable, people-centered healthcare? Visuals. People in communities growing herbal medicine. Young scientists developing natural treatments, crowds cheering Traoré copyright speeches. Narrator. Around the world, a movement is growing. Doctors, activists, and leaders are demanding transparency, accountability, and freedom from pharmaceutical dominance. Conclusion. Narrator. Powerful tone. The $50 billion conspiracy is not just about Tylenol. It's about a global system designed to profit from our pain. Ibrahim Traoré copyright has exposed it. Donald Trump warned about it. And now, it is up to USA the people to demand change. Because true health is not found in overpriced pills. It is found in truth, in knowledge, and in the courage to break free.